Hello students, good morning. Myself Dr. Shiva Saravanan, Professor, HOD, Department of Surgery, Vinayaga Missions Homeopathy Medical College, Salem. Today topic is gastritis. It is one of the commonest clinical condition we encounter in clinical practice. What do you mean by gastritis? It is an inflammation of the lining layer of the stomach is called as gastritis. Based upon the clinical categorization, it is divided into four major varieties, in that type A gastritis, type B gastritis, reflux gastritis, erosive gastritis. Depending upon the various factors which is influencing the gastric mucosa, again miscellaneous lesions are given. In that most commonest is stress gastritis, lymphocytic gastritis, granulomatous gastritis and phlegmonous gastritis. These are very less encountered conditions of gastritis. Coming into the most commonest gastritis varieties, the first one is a type A gastritis. In that it is autoimmune disease. Our immune system is turning against our own gastric mucosal cells. That is, formation of severe anti-parietal cell antibodies has been developed. In these conditions, the parietal cells are responsible for the secretion of hydrochloric acid. In this, what will happen? This parietal cell dysfunction is happening so that there is no proper secretion of hydrochloric acid in the stomach, which can result in severe vitamin B12 deficiency, which is getting absorbed in the intestines. In that, most characteristic point is gastric antrum is not affected in the type A gastritis. This G cell hyperplasia occurs is another characteristic point. Is due to the antibodies development resulting in the serum gastrin levels. Okay. There is a severe microadenoma can happen because the destruction of the antiparietal anti-cell antibodies resulting in gastric carcinoma. Then coming into the next one, type B gastritis, it is purely of infective origin, Helicobacter pylori infections. In that, gastric antrum is also affected, is quite common in the development of peptic ulcers. The Helicobacter pylori infections can result in severe inflammation of all the layers of stomach, that is mucosa, submucosa, serosal layer as well as muscularis, which can turn into a severe gastric cancer. Coming into the reflux gastritis is mostly due to various surgeries which can result in the reflux gastritis. While performing some other gastric surgeries, they can accidentally injure the certain sphincters. As you all know, we are having a bile duct opening in the second part of the duodenum as well as a pancreatic duct opening in the second part of the duodenum. Those acids are getting entered in the second part of the duodenum. If there is any surgeries which happening at the head of the pancreas, it can weaken the sphincters so that there is a higher possibility of juices getting entered in the stomach. These juices are quite having a lytic activity, so it can cause severe erosion to the gastric mucosa. It can result as reflux gastritis. Then coming into the erosive gastritis. This erosive gastritis happens mostly due to consumption of excessive alcohol. It can gradually deteriorate the protective mucosal barrier, which is preventing the gastric ulcer, has been destroyed by the alcohol. So that due to alcoholism, the patient can develop severe gastritis. Those sort of gastritis are called as erosive gastritis. Then coming into the miscellaneous varieties, the lymphocytic gastritis. As I told already, there are certain disease conditions have autoimmune. Our own immune system is getting turned against our own gastric mucosa. It can result in severe accumulation of these lymphocytes, resulting in the inflammatory process. So those kind of inflammations are called as lymphocytic gastritis. Due to the chronicity which happens in the mucosal layers, it is after that we can able to classify it as a granulomatous gastritis. This happens mostly due to the tuberculous conditions as well as Crohn's disease. These two conditions are having a chronic impact on the mucosal layers. Coming into the clinical features, what we can expect in the clinical features of gastritis? As you all know, we are having extra fullness because due to the erosion of the gastric mucosa, it can result in more amount of acid secretion in the stomach. So that very small quantity of food with massive amount of acid, it can result in the severe instability in the gastric mucosa, so that there is a blotting can happen due to the gas formation, due to the instability of the acid changes into a gas, it can go for the severe blotting. Then loss of appetite, abnormal abdominal pain, nausea, vomiting, then hematemesis in this erosive gastritis. As I told in the alcoholic, the patients, it can result in severe gastritis, go for the hematemesis. Hematemesis is nothing but blood vomiting. Due to the extensive erosion of the gastric mucosa, the blood is getting seeped up from the gastric mucosal layer. While patient go for the vomiting, the blood comes out. It is called as a hematemesis. Then black tarry stool in cases of severe upper GIT bleeding, especially melena. These kind of stools are called as melena. Due to the severe gastritis, the patient will have a black tarry stools and appear in the morning defecation. Okay. This upper GIT bleeding is characterized by melena. Why it is dark black in color? Because these iron contents are getting oxidized in the intestines while traveling along the entire 6 meters of small intestine as well as the large intestines. Is getting oxidized and turned into a black in color. Coming into the investigation part, is the most commonest investigation is a breath test. In order to confirm the H. pylori infections, we have to make a swallow of capsule or liquid containing urea. It is one of the harmless radioactive material. Then you have to exhale it in a balloon-like bag. Once the H. pylori is present in that mouth or in the gastric mucosal layers, it can react with the carbon dioxide. It can have an increased amount of carbon dioxide. You can able to see it in the bag because the urea is getting react with the atmospheric air and have a more amount of carbon dioxide. You can able to see it in that bag. So indicates the H. pylori has been present in the gastric mucosal layer. The H. pylori infection commonly produces ammonia as a end product. So it reacts with the atmospheric air in order to increase the carbon dioxide. Then coming into the blood test, a blood test is always to check the antibodies. Whether it is a type A gastritis, you have to rule it out, you have to check for the blood test. Then stool test, sometimes this H. pylori is getting excreted in the stools, so that the confirmatory test also done by doing the stool. Then coming into the advanced investigations, this upper endoscopy. It is in order to visualize the entire gastric mucosa, how much it has been. You can able to see the changes in the gastric mucosa. You can able to see it in the endoscopy. Then complications of gastritis. Due to severe erosion and instability of the gastric pH and various secretions of stomach, it can result in various complications like anemia, pernicious anemia, peritonitis and stomach acid. In case of malabsorptions, you can able to see the anemia and pernicious anemia. In case of severe ulcerations, it can lead to perforation of all the layers of stomach, that is mucosa, submucosa, serosa and muscularis. All the layers are getting perforated. It can result in the effusion of stomach content into the peritoneal layer, resulting in peritonitis. Then repeated ulcerations, and the patient is not following the proper order of maintaining the health, it can result in stomach cancer. Then coming into the general management, as you all know, bacterial infections are quite common in the water and food contaminated conditions. In order to get rid of the H. pylori infections, we have to do the proper hand washing, maintaining the public hygiene. Then avoiding more amount of fat, fried, spicy and acidic content in the empty stomachs. Then cutting off certain caffeine content, it can slowly get rid of the gastritis. Stress is another major reason for developing of more amount of acid in the stomach. So we have to make ourselves comfortable and facing various situations, and you have to keep calm in handling certain situations, can totally get rid of the gastritis. In concern with the alcohol, reduced consumption of the alcohol, which may reduce the erosive gastritis. Some of the individuals, they will immediately after taking the food, they will start lying in the bed. So it can result in the severe gastric stasis, resulting in the severe instability of the acid content. It can further lead to gastritis. So immediately after taking food, no one should lie immediately. They have to do certain physical activity in order to get the proper digestion. Then coming into the homeopathic perspective, we are having a very good drug. There are a lot of drugs. In that, most commonest drugs in the clinical practice, first one is a carbo-vegetalis. This drug is more indicated where the patient is having a more amount of gas in the upper abdomen, that is epigastric region. Whenever the patient feels he is having a more heaviness in the epigastric region as well as burning pain, immediately you have to think of carbohydrate. Then the patients have a history of already taken more amount of spicy foods, fatty foods can result in this sort of gastric disturbance. We can think of carbohydrate. It is more indicated for the old age people. Those already their metabolism, digestion process somewhat slow in nature. When they consume more amount of high fatty foods, it can result in a slow digestion. So those are the characteristic points for the prescription of carbo-vegetalis. Then coming into the natrum carbonicum. Whenever the patient is having the problem of having certain milk and milk products, we can think of natrum carbonicum. Dairy products, the patient has developed severe discomfort, we can think of natrum carbonicum. Those who are allergic to certain foods like nuts, various commonly used herbs is not applicable for them. We can think of natrum carbonicum. Then naxomica. It is a day-to-day drug. As you all know, the persons are having the habit of taking more amount of spicy foods, alcohol. After that, the consumption, the patient has developed gastritis. We can think of naxomica. It is a lifestyle drug. It produces severe burning pain in the stomach, as well as it can result in severe cases, blood tarry stool, you can able to see it. Those are the indications of naxomica. Then natrum phosphoricum, it is also one of the major drug for the milk and milk products indigestion, which can resulting in the gastritis. The patient has a peculiar craving for fried eggs, even though he is in the severe gastritis form. Patient will develop severe sour vomiting along with the regurgitation of biles. Is another characteristic point in the prescription of natrum phosphoricum. Then coming into the lycopodium. Lycopodium is quite often indicated in the irritable bowel syndrome patients. The patient is quite hyper responsive to any kind of high fatty foods, as well as when any food which is disturbing the metabolism, we can think of lycopodium. Patient will develop severe bloating along with the gas formations whenever he consume more amount of onion or garlic. He had a severe intolerance, especially for the onions, oysters, cabbage, beans. He has a typical time mortality aggravation. The symptoms are getting worsened in the time period, especially 4 to 8 p.m. He is quite relieved by passing the flatus. His patient is having a typical appearance of lean, thin individual. These lycopodium patients are keen and intellectual persons. That's all about the gastritis. Thank you for watching my video.